Hi, I'm John Selberg, Fire Chief and Emergency Manager for the City of Germantown. During this pandemic, my main role has been to help coordinate the city's response to COVID-19. As we enter the last month of the year many of us would like to see go away, I wanted to give you a quick update on where we are at. Germantown has responded well to the challenges of COVID. Our citizens and business community have done well to heed the warnings and take necessary precautions to limit the spread of this virus. Germantown remained in the lowest of the four tiers for COVID-19 cases within Shelby County for most of the time. However, for the past month or so, we have moved up to the highest tier for COVID cases within Shelby County. This is a trend we are seeing in many of the suburbs as well as rural counties. Currently, we are in the next to the highest tier for COVID cases. Recent statistics from the Shelby County Health Department shows that we are seeing about 114 new cases in Germantown every week. That's over twice what we were seeing just back in October. This is 22% increase over 2 weeks, and the rate of increase in our school-aged kids is even higher at 30% over 2 weeks. Fortunately, our death rate is fairly low, but most of us know someone that has been hit hard by COVID-19 or even lost their life to it. Anyone that has watched TV or turned on their radio has heard that COVID cases are spiking again. We have actually surpassed the peak we saw back in July, with an average of almost 400 cases per day locally. We anticipate this pattern to continue unless we can do a better job to slow it down. The biggest concern is the impact on our healthcare system and its ability to handle these cases, as well as other medical needs. Hospitalizations are currently at the highest levels we've seen, with about 500 people in the hospital daily. This is heavily taxing our hospitals, which are already dealing with staffing challenges. The availability of beds and the high number of hospitalizations directly impacts the emergency departments, as well as the ambulance services trying to bring critical patients for care. We felt that right here with our Germantown Fire Department ambulance service as we work to take care of our neighbors. The increasing cases have caused the health department to look at ways to help slow the spread and get it under control, including the dreaded restrictions on our businesses. This isn't what we want, especially as we go into the holiday season. A challenge they are seeing is the large number of people that are infected and still going out in public. A local study shows that 49% of people that became infected reported that they disregarded the need to isolate and went out anyways. 76% of them were still going to work, and 39% reported going out in public or to social events. This is preventing us from getting the spread under control. That right there is reason enough for all of us to take the necessary precautions when we're out in public or at work to keep from getting infected by those around us. You never know who is actually infected. We've all heard that a vaccine should be available soon. Initially, it will probably be available to those at the most risk, including healthcare workers, our vulnerable senior population, and first responders. It will probably take a little while before it is readily available for all of our citizens. Our local epidemiology expert, Dr. Jane, suggests that we really won't have this virus controlled until we have about 70% of our population immune. I'm sure that there will be some people reluctant to get the vaccine, but the quicker we can get most of our society immune, the quicker we can get this COVID-19 behind us. So as we go into this holiday season, let's be smart and take those precautions necessary to reduce the chance of infection so we don't have too many of our neighbors spending the holidays in the hospital. If there was any chance that you were sick, please isolate yourself from others. It's the caring thing to do. Even if you don't feel too bad, you don't want to be responsible for someone else getting sick or worse and dying from COVID-19. We're so close to beating this COVID-19. We can't let up now. Let's firmly usher it out of here. Thank you.